Hey, it's Robbie Stahl, and welcome to the Fitness Doctor Coaching Show, where we help you do all the things you love to do and even improve in them with age. And today, I have none other than my brother from another mother, Dr. Trent Nestler. Welcome to
Thank you for having me, Robbie. I really do appreciate this.
Today, we are going to share with you some super insightful things, some very important things about your back functionality, your back health, your core, your hips, your pelvis, all of those things in the midsection of your body that you can't live without. And sometimes it can get so painful that you really almost feel like you can't live with. We're going to help you overcome those things and make your life a whole lot more functional in that region of your body. So Dr. Nestler is going to take his clinical pearls and his 30 plus years of experience, and I'm going to take my 27, and we're going to combine them and make sure that you get amazing value out of this next 40 minutes or so together. You ready? Are you ready, Dr. Nestler?
I am so ready, Robbie.
Awesome. So if we talked about this before we started the show, it's like, what do you think the most powerful, impactful things are? The things that really move the needle to help you the most. And we came up with three things. What were
Mhm.
those things, Trent?
Three were hydration, mobility, flexibility, and then also breathing. I say the hydration because people don't really realize how much hydration actually impacts low back pain.
Amazing. So we're going to do hydration, breathing, and that midpoint we're going to call biomechanical optimization. So your mobility, your stability, that one's pretty thick. There's a lot of stuff for us to get through
A
there.
lot of stuff in there.
We'll get into the details as we get there. Trent, I know you actually you're directly connected with one of the most elite hydration experts literally in the world, someone who's done more research and has more knowledge in that area than anywhere else. Isn't that correct?
That is correct.
So shoot, my friend, I don't think anybody's more qualified than you in the way you apply it to tissue and
Well,
mechanics.
you
And
know what? Yeah, the interesting thing to me is that the correlations that are being done with the amount of hydration and specifically chronic dehydration and what that does to our overall body. We know that there is an impact on the viscosity of your blood, for example, oxygen transportation, getting tissues the good volume of oxygen that they need for contraction. But what we don't realize is what that chronic dehydration does to the tissues of your hamstrings, the collagen tissue, the muscular tissue of the hamstrings, of your quadriceps, of your hip flexors, of the disc of your spine. The disc of your spine is 80 to 85% hydration or water. And what ends up happening is that over time, and especially as we mature, one of the things that we often hear people report is that I've lost height. So why do you lose height? Why do women's feet get bigger as they mature? Part of that has to do with the fact that those tissues are dehydrated and they're not as resilient. That resiliency of those tissues is lost. And therefore, what ends up happening is that the spine actually starts to compress a little bit. Sometimes people report losing up to 2 to 3 inches in height over time simply because the disc space is getting less and less and less. And obviously, if you're going to lose disc space, and obviously those nerves, they don't get any smaller. The nerves that are going through the foraminal hole is not getting any smaller. So if you're reducing that disc space, that can add to a lot of the back issues that we end up seeing in people. We often, there's a lot of times where I'll be working with somebody, and one of the things that I'm constantly feeling for is the pliability of tissue. And you very much feel a difference in the pliability of a tissue of someone who is chronically dehydrated, or chronic smokers, because chronic smoking also leads to that chronic dehydration. But when you feel the tissue of a hamstring of someone who's chronically dehydrated, it's not near as resilient. It feels a little bit harder, a little bit stiffer. And that stiffness and that hardness actually adds to a lot of problems down the road. And so for me, hydration is an absolutely critical thing. And the coolest part about it all is that you can really see when a patient comes in and you start taking a history, you can actually see that. You can see it in their skin. You can see it in their nails. You can see it in their hair of whether that person is chronically dehydrated or not dehydrated. Someone who is chronically dehydrated, they're going to represent that on the external. They're going to represent it in their skin. They're going to represent it in their hair. The thing is that that is also represented on the inside of the body, and most specifically is in the disc. Most specifically, there's a lot of really good research coming out about the impact that dehydration has on low back pain. You're at a threefold increased risk for low back pain if you are chronically dehydrated.
So then the really important question becomes, and I know you and I recommend the same exact thing here, but I'll let you answer it, is well, how do we know whether we're hydrated well enough or not? What
Yeah.
should we do to know that?
Well, the number one litmus test is the color and the odor of your urine. I don't mean to be crass with that or anything, but it is truly every single time that you go to the bathroom, you are doing a litmus test on whether or not you are properly hydrated. If that color is dark and it stinks, you know that you are clinically dehydrated. And in the absence of vitamin packs, in the absence of asparagus and things like that, there are things that will change that color and that odor. But as long as is you are drinking enough and you're not doing these other things on the side, you should see that reflected in the color and the odor of your urine every single time. And the cool thing is that it can guide you throughout the day, because there's many a times where you get busy and you get distracted and you forget to, be drinking your water. And you go into the bathroom and you're like, holy cow, I'm dehydrated. I need to up my water intake.
Yeah, I love how actual easy it is for you.
It is very easy.
Yeah, for you, our audience member, to be able to take the litmus test, as Trent calls it, to know are you hydrated or not. So you want more of the clear and very light yellow colors,
Yep.
minus B vitamin, minus asparagus, which can change the color of your urine. But the rest of your days, look and see what color is your urine. Is it getting more to that darker yellow or orangish color? Or you're staying more light yellow, and that's just the simple test. And if you do that, and you're keeping yourself more towards that clear side, that's the thing to do. Trent, what do you think about, so hydration is obviously water, right? And
Right.
but what other things could be involved in hydration that you feel would be really important, especially for our individuals that are mostly in their 50s, 60s, 70s, and 80s?
Yeah, Robbie, as we were talking about that, one of the things that I would recommend, especially for our mature clients, is if they're also on medications, is to making sure that they're speaking with their doctors, talking to their doctors about any increases that they're going to be doing with their hydration, because that can, dilute some medications and things like that. So your doctor needs to be aware of that because there could be some impact on medications. The other piece of that is your electrolytes and making sure that you're getting a sufficient amount of electrolytes. And everybody's a little bit different. There's some controversy around that. Like, do you need electrolytes? Do you not need electrolytes? For me, what I will tell you is that I think most people will know if you're going to have signs that you need some more additional electrolytes. One of those signs is what, Robbie?
Muscle cramping, spasm?
Absolutely. Number one. So if you're having a lot of muscle cramps and you're having a lot of muscle spasms, that is one key indication that maybe your electrolytes are a little bit off. And again, it's really important that I think that folks either do a screening with us through our VIP portal and the ways that we do that, and speak with your physician about your hydration, especially if you're going to be changing the magnitude of your hydration and you have medications that you're on.
So just to help you as the audience member, what Dr. Nestler just shared is that you can schedule a consultation with us to get into these factors and any other areas that we're talking about in today's episode, or your fitness and body mechanics and any other area of your body. There's a link on this page to schedule a private consultation, and you can do that there. Let's go on to the next subject. And by the way, I will share, I used to not utilize electrolytes on a daily basis, and now I have for some time, especially when I was doing that competitive sport that you have on that TV behind you there. And Dr. Nestler, I've seen this guy be like the leader in leading doctors, leading sports medicine in every area that has to do with body mechanics, which is why he is my preferred colleague and even mentor of choice. And he is an elite expert helping athletes of martial arts and special forces get into these great conditions as
Mhm.
well. So that's the grappling you see going on in the background there, and also one of the reasons why he's, what are you now, 55, Trent?
Yes,
And
56
and
soon.
absolutely ripped like a 25-year-old elite level Olympic athlete. That's why. So let's continue. Next category is biomechanical optimization, as I've coined it. And what the heck is that? It's basically getting your body in the proper alignment
Mhm.
per body segment. And when I first really got into this deep, deep, deep subject about 17 years ago, Trent and I were talking about, you know, is what is biomechanical optimization to you? And he's like, well, every segment of the body has different needs for that.
Mhm.
And so that's why we call it biomechanical optimization, is because each segment, you can't just call it anything because each body area has its specific needs. We're going to dive into what is the pelvic, core, back, hips region of
Mhm.
your body. What does that need in terms of biomechanical optimization? And so, Trent, and we're both going to share from our
Yeah,
perspective
for sure.
what we've seen, so
Yeah.
that you, the audience member, can benefit the most because we're 100% aligned, but we have a little bit different
Yeah.
perspectives on some things that we've seen. So, Trent, go ahead if you'd like to go first.
Yeah, yeah. One of the things, Robbie, that has been probably one of the things that I focused a lot, probably in the last year and a half, is really on the pelvis, on pelvic stability, and the impact that hip mobility has on overall function of the spine, function of the core, function of kinetic energy transfer across the system. And so for me, and especially with the population that we have today, people have become progressively less active. We are becoming much more sedentary. We're sitting a lot more than we used to. And sitting has consequences to it. And one of those consequences is that you significantly impact the mobility of your hips. And that is so critical because with every step that you take, typically you have one hip moves into extension and you have one hip that moves into flexion. And any change in the ability to get full hip extension and whole hip flexion on the opposite side during your normal walking gait, what'll end up happening is that if you don't have that, what ends up happening is that you start to rotate at the pelvis. So with every step, you start doing this instead of this. And what should happen is this, so that the spine stays in a relatively neutral position as you're walking or you're running or whatever it is, you're hiking or whatever it is that you're doing. But if you lack this motion of this hip flexion and hip extension, then what ends up happening is that the spine or the pelvis then starts to rotate because you don't have enough hip extension. It's going to take your hip and rotate it this way. And then it's going to rotate this way with every step that you take. And what that does at the spine is it causes a lot of twisting at the spine. The spine's not meant to do that. The spine is designed as a compressive, to take compressive forces. Anytime that we start getting a lot of rotation, especially in the lower lumbar spine, that can add to a lot of problems. It can add to a lot of facet problems. It can add to a lot of disc problems. So one of the things that's been, and I guess, Robbie, I hate to say this, but age has taught me some things. Besides what I've learned in a book, besides what I've learned in courses and what I've learned from research and things like that, I'm learning on myself and I'm learning in my own body, because I am 55 years old. And I'm still trying to be a competitive jujitsu athlete. And one of the things that I'm finding is that, there are age-related changes that are occurring in my body that I have to change the way that I approach my training. And from that, it's also helping me help others to avoid a lot of the pitfalls that I've had, a lot of the pitfalls that I've run into because of this whole lack of hip mobility. And so, it's interesting because if you lack that hip mobility, think about how many steps you take in a day. But it's not just steps, it's also squatting. If you don't have good hip mobility, when you squat, when you sit down to you sit down to a chair, you sit down to your bed, you sit down to your car, you sit down to a commode, you're going to alter the way that you sit down. And so one of the things that we see that happens a lot is that people start to, if they've got lack of hip mobility, is that they'll either rotate their pelvis or they shift their pelvis over to the side. And you do that once or twice, it's not that big a deal. But if you do that day after day after day, rep after rep after rep after rep after rep over time, that can add to some pretty significant problems. It can add to hip problems, it can add to back problems, it can add to disc problems, et cetera, et cetera, et cetera.
Yeah, I love what you shared there. And I want to share with our VIPs. So we have some audience members here who are part of our just audience, and we love you.
Mhm.
And then we have individuals that are part of our inside VIP family, and we super love you. So why do we get into the stride position so often with lunges
Mhm.
and other things? And why do I get so detailed on what's happening with the pelvis? And our VIPs know that it's neutral, it's not rotating, and that
Yes.
sacrum staying centered. So front, back, neutral. not rotating when we get into stride, and sacrum staying centered. And then we move the hips from that position is because of exactly what Dr. Nestler just said.
Mhm.
And then the hip mobility, that's so important. And the only way for you to really know, do you have adequate hip mobility, is for you to test. So that's why for our VIPs, we test to the actual degree, and then we compare left to right because asymmetries in these things that Dr. Nestler just shared. And I'm going back and forth because Trent
Yeah,
is my very good friend. To you, he's Dr. Nestler. To me, he's Trent, right? So,
always be trying.
so exactly as Trent just shared, the when you're if one side has less hip extension capability than the other, then that can also really get you in trouble. So there's factors that have to do with mobility, but there's also factors, as Trent mentioned, that have to do with like pelvic alignment and stability. So
Yeah.
if you think about your body mechanics from the standpoint of that really you want to have a pelvis that's aligned and a core that's stable because you have limbs and other body parts that rotate and move in simple terms around that stable axis. And so that's the proximal, what we call proximal or center part or closest part of the body. You want that to be very stable. But then if you have other parts, as Trent just explained, like the hips that don't have the mobility, then they put added force on the stable part. So all this to really say it really depends on, for example, if you have a pelvis that's more tilted forward, like extra back arch, and your abdomen tends to kind of stick forward, for example, if you're that individual or the extreme opposite, kind of a butt tuck. I always think of the 90-year-old in the grocery store pushing the shopping cart with his trousers dropped straight down to his hamstrings. That's kind of the posterior tilt. If you're in these extremes, you're actually you're actually what we call hypermobile towards that extreme position. So you need alignment. But there's some individuals that will see like, oh, your back actually looks a decent aligned from that standpoint, but there's these other areas where we really lack hip mobility. So then that's going to pull and add additional stress. So it really depends on your individual mechanics of what you need to address, as all things. But to help you, it's like, how's your pelvis? Is your pelvis neutral or is your pelvis more tilted forward or is it more tilted back? How's your breathing mechanics? Do you breathe properly? And coming up, I'm going to show you some breathing mechanics so we can like look at that as well. Trent, what else would you say?
Yeah, Robbie, you alluded to this limb symmetry. And so what is limb symmetry? We actually, in the research terms, we call it LSI or limb symmetry index. And it's simply a comparison of your right side to your left side. And there's a lot of really good research out there about, this is originally done in the shoulder. And what they showed is that if your total shoulder range of motion is different by greater than 10 degrees between your right side and your left side, if you are an overhead athlete, so if you play pickleball, you play tennis, or you're a baseball player, that you are 3 times more likely to suffer a labral tear if you have this variance of greater than 10 degrees. Now, the interesting thing is that same statistics has really been shown, quite honestly, across the entire body. So whether it's your knee range of motion, your hip range of motion, et cetera. But what I wanted to highlight here, because a lot of our audience are golf, is that if your total hip range of motion is greater than 10-degree difference between your right side and your left side, you're 3 times more likely to have back pain. So if you think about a golf swing and how much external rotation to internal rotation you go at the hips, if you don't have that internal and external rotation of the hips, what ends up happening then is that you end up rotating in the pelvis and in the spine. And that adds to an increased risk for low back pain. So this concept of symmetry to me is probably, one of the things that's the most interesting. It's the easiest thing to assess is look at your right side, look at your left side. And if there's a variance, then we need to try to balance that out. Now, granted, there's going to be some variance if you're right-handed or left-handed, if you're right foot dominant versus left foot dominant. But overall, that limb symmetry should be relatively equal or within about 10% or 10 degrees of each other. Anything outside of that lack of, hip, like what we're talking here, hip flexion and extension or hip internal and external rotation really sets you up for a lot of problems because force is generated not in the core. Force is generated in the hips and in the legs, and it is transferred across a stable core for kinetic energy transfer. So whether you're, a pickleball player or you're a baseball player or you're a golfer, that force is not generated in your arms. It's generated in the hips, transferred across the stable core to the upper extremity.
Trent, before we go further, and for you, our audience member, you mentioned labrum and you mentioned some things that can go wrong with that. Can you
Yeah,
simplify that even more so that
sure.
everyone 100% understands?
Yeah, so absolutely. So I talked about labrum in two different scenarios. Number one is up in the shoulder. So a labrum is cartilage in your shoulder that is a common tissue that is injured. And in the shoulder, if the labrum is worn away and there's excessive bone-on-bone contact, that can be one thing that leads towards like a total shoulder replacement. Now, in the hip, there is also a labrum in the hip that also serves between the acetabulum, which is a part of your hip, and then the femur comes in at the femoral head, and they come together. And right in between those two is the labrum, and the labrum kind of creates kind of a cushioning, kind of like a meniscus. And again, chronic dehydration dries that thing out, and a lack of mobility can cause excessive wear on that. And it can be one thing down the road that leads to this bone on bone, which then leads towards a total hip replacement down the road, or hip resurfacing, or whatever that may be. So the labrum is a super important structure, both in the shoulder and in the hip, and it's something that you want to preserve. And going back to hydration, that's one piece of preserving that. The second piece of that is exactly what we're talking about, Robbie, and that's the biomechanical optimization. And making sure that things are moving the way that they should be moving, creating that symmetry so that there's not excessive wear and tear on that particular structure.
Awesome. Thank you for the clarity. And then another thing that I'll provide to you, our audience member, is basically, and our VIPs know this very, very well, and that is a neutral pelvis. So basically, if you tilt your pelvis, which is the bucket your spine sits in, if you tilt that forward, we call that anterior tilt. And if you tilt it back to where your butt is tucked under you, that's posterior tilt. You want a neutral position. For simple terms, you kind of want to be about 50-50 between those two positions where you have a small amount of back arch for most exercises, for most positions. There are times that we would move out of that, but most exercise, you kind of want to hold that proper stabilized position when doing a squat, when doing lunges. And it's really important to first sense and feel what your body's doing and take your motions in incremental positions because the way you feel will lie. Okay. So the way something feels and what you're actually doing are different. You'll feel, oh, I'm neutral. And your back has like 20 degrees, I'm exaggerating, 20 degrees extra arch, right? And then you tuck your butt under, you're like, wow, I couldn't believe how much I had to still tuck my butt under. My back was arching so much. Or some people are the other extreme opposite. So you really want to sense and feel your body mechanics into all these alignments. As an audience member, you might have been to Full Body Fix. I share all these things with you. As a VIP, we actually put these things and these functionalities into your body for you, guide you in every step of the way, and make sure you're getting it absolutely perfectly. So again, if you want to schedule a consultation, that link's on the page. Trent, let's go into breathing mechanics. But before we do, I would love to show a visual of what your breathing mechanics inside your body should actually look like. Before I show you the mechanics of the body, let's talk about what most people do. Most people breathe in through the chest and rib cage, and they have a tendency to really focus on the front side rib cage, right? So doctor says, hey, let's check your heart, let's check your lungs, and you lift your chest really big and you overarch your lower back and your abdomen's really not even involved. And this is pretty typical breathing, especially as we get into 60s, 70s, 80s, and beyond. And even in 20-year-olds, okay? It's this pattern of breathing, it's actually considered dysfunctional. It causes excessive extension in the lower back. It causes issues there. It actually causes you to kind of be forced into positions that you shouldn't maintain and hold. And it really negates the functionality that many tissues in the center, core, abdominal, pelvic region have. So what should you do? What does ideal breathing look like? Well, I'm going to actually show you inside the body what your breathing should look like. Here's the image that you're looking at. You're looking at the front side of something very similar to what your body would look like on the inside. Here is your heart. Here's all your organs. I'm not going to get into all the details of them, but here's your organs in your abdominal cavity. And when you breathe in, yes, your rib cage should expand. That is correct. That is good, but not just from the front, your backside rib cage, and it kind of should expand evenly outward, laterally, and also into the back, not just elevating in front to cause like back arch. And then down here in the bottom of the screen, which you can't really see in this visual, there's a thing called your diaphragm. And it's kind of like a sheath of tissue, okay? Or a sheath of tissue is how you could look at it. When it contracts, it goes down and it clears space for your lung. So your lung is here and here in this black space, okay? So when you breathe in, your rib cage expands and your entire organs actually go down because your diaphragm is contracting. And then below the diaphragm, your pelvic floor, which is all the tissues around your groin area, those should actually relax. So when you breathe, lungs inflate, rib cage expands, Organs drop down, diaphragm drops down, pelvic floor relaxes. Okay, so let's see all those things happen. So now we're seeing what I just shared with you in action. You can see as the breath goes in, the organs drop down, rib cage expands, lungs expand. See, right there, boom, lungs expand. So that's an exhalation. Here's an inhalation. Ready? Inhalation. So that's the inhalation. Organs are dropping down, lungs are filling up, rib cage is expanding. And when you exhale, diaphragm's coming back up, lungs are letting the air out. So now to simplify, when you breathe in, you don't try to make the abdomen go out. You don't have to try. Let it go out. And then when you exhale, your abdomen should come in. And your pelvic floor should have a little bit of contraction appropriate to what you're doing in the physical activity. If it's more intense physical activity, then it's more intense contraction. Breathing in, rib cage, abdomen comes out, pelvic floor relaxes, and then you do the opposite. Why are all those things so important? Because there's all these interworkings of your own internal weight belt called the transverse abdominals and all many other tissues, and the way they function have a lot to do with your breathing that then stabilize your spine. Trent, what would you like to share about this topic?
Yeah, one of the things that your diagram and the video showed really well is when the diaphragm comes down is how much the lungs expand. And that's super important because I've read some studies that when you do this form of breathing versus you being a chest breather, is that you get about 1/3 increased capacity of oxygen in the lungs. And that's super important. It's super important, obviously, to breathe. It's super important for life, but it's also super important for soft tissue healing, super important for resiliency of tissue, super important for repairing of tissue. When you optimize the oxygen, you're going to optimize the amount of oxygen in the blood, which is absolutely critical for soft tissue repair. It's absolutely critical for optimizing physical capability. So when you talk about that, not thinking about it as just a breathing exercise, but what it's also doing for your overall function. When you optimize the O2 in your blood, you decrease brain fog. When you optimize the O2 in your blood, you optimize your soft tissue's ability to heal from your pickleball session. When you optimize the oxygen in your blood, you optimize and decrease the pain that you have in your low back. So there's so many downstream effects of that. In addition to, just not looking at it as just a breathing exercise, but really what does that do for you systemically, for your overall resiliency, and ability to heal?
Wow. Yeah, exactly. That is huge. So if we take everything we just shared, and then if you're staying well hydrated and you're breathing well, like these are foundations of life. Now you have proper hydration, which allows tissues to heal. They have their right viscous material, right? Because tissues are like viscous type of material, right? It's not when you turn them into dry rubber bands, they usually don't work so well and you start feeling aged. When you do the opposite, lots of good O2 or oxygen and lots of good hydration, and then you have the right body mechanics and you're breathing well, these things we've found to be the most profound of all things you can do for your back health. So if you're not doing those things or you feel like you're missing some of those elements, this is the secret sauce of which we share with you that we've personally seen the most results in thousands and thousands of individuals that we've worked with. Trent, anything you'd like to share? Any
Yeah, absolutely. I think sometimes people try to take one piece, like here's the one thing I need to do differently. And really, I hope what people are taking away from this is that it's really accumulation of factors. Hydration, in the viscosity of your blood. Less viscous the blood is, the less ability it has to transport that oxygen to your soft tissues. So there is such a downstream effect that over time that these things can have. And unfortunately, when you're in your 50s and your 60s and your 70s, this is really where the rubber meets the road. You could get away with that in your 20s, and you could get away with that in your 30s. And I would even say you could probably get away with that even in your 40s. But as you start getting into your 50s and your 60s and your 70s, in order to optimize your health, in order to optimize your resiliency, in order to optimize your well-being, these are the things that make a huge difference for overall health.
Yeah, exactly. And so when you take all the things you could be doing and all the marketing stuff that's being sent to you on a daily basis, I'm sure our audience member, and you look at the breathing, hydration, physical functionality. These are the things that's at the root, that's at the foundation. You can do all the special procedures and, as I call them, lotions and potions in the world, and they don't make nearly the impact as these are foundational things. So, not that those things can't have amazing benefit. The supplements and stuff, sometimes those things can literally be like life-saving for some individuals. But nothing's more important than this foundation of your functionality. And if you'd like to learn more about the foundation of your functionality and have us look at, evaluate, and see where is best for you to take action and how to improve your functionality, you can schedule a private session with us. As a VIP, you have your fitness doctor experts. You can schedule that directly with them. You already have access to that. Or as a VIP, if you want extra special consultation, you can schedule that with Dr. Nestler or with the fitness doctor team. And then for our audience members, if you'd like to schedule a consultation that offers also specially there for you as well. Normally that's $297. With this session, it unlocks the door for you to do that at $97, or if Dr. Nestler's included, that would be $197. So it just depends on what kind of consultation you want, but those links are on the page now. And with that, that's a wrap. We'll see you in our next session together. Lots of love to you.
Lots of love.